Hey Tim, how are you, Mike?
How you doing, Dr. Loria? Nice to see you.
Today is D-Day for you, my friend.
Yes, sir.
All right. How's your trip over from around Orlando area? Right?
Not too bad. Traffic a little crazy, but
Yeah, I know. All right, Tim. So I have your medical history here. Everything looks good. No history of really much here. So you're a healthy guy, young guy. Okay. All right. Now, did you have any questions for me? We can go over some basics, but I want to first entertain your questions.
honestly, question that I had was regarding the filler itself.
Okay.
I do know that on your website it says that it's an oil
Base? Yeah.
Okay, and then that's what creates it into the collagen.
Exactly right. I'll tell you exactly how it works. Silicone oil has been used for 80 years.
Okay.
We use it in all forms. We use it in oil, gel, rubber, and solid. Okay. The solid we put in for, let's say, chin and cheek implants.
Okay.
Also in other body parts. It's the most used bioimplantable material in the world. So we have the solid for certain body parts. We have the rubber that goes in certain body parts, but also for the bag for the breast implant.
Okay.
We have a gel form, which is actually the gel goes inside the breast implant. It might go in other things too, but generally there. And then you have the oil that we use for as a filler. Okay. Now, how does it work really? Here's where the magic is. When you have cis pure oil and inject it doesn't work very well. That's why a lot of doctors, not a lot, but some have difficulty with it. Okay. It just doesn't behave the way you want it to. You want it to form collagen, right? The way it forms collagen efficiently and effectively is when you take the oil and make an emulsion, make it look like milk.
Okay.
Now you have millions of little droplets. So now as you inject this, no matter anywhere on the body, it could be a penile area, it could be a cheek, face, whatever, it doesn't matter. When the solution goes in, the body will dissolve the cellulose portion. There's two parts to it. It'll dissolve the cellulose portion, but when it sees a little droplet of oil, you know what it does? It surrounds with collagen.
Okay.
So imagine having a layer of this in the penile skin of the solution, right? As it starts dissolving the cellulose, when it sees a droplet of oil, it surrounds it with collagen. Then it surrounds it again and again. So it makes a sheet of collagen.
Okay.
It's a beautiful thing. If you were to actually go inside your skin after it was produced, it would be a thick layer of collagen. Those little tiny droplets you don't see, but that's what keeps it permanent. And that's the magic right there. Okay? And we've done this over 10,000 times. Just in the genital area, but I've done it in women's faces. I've done it all other parts of the body. In fact, you're a lifter, right?
Yes.
You know, if you rupture your tendon here, your biceps tendon, your muscle shoots up. You ever see a guy like that?
Oh, it happened to me before.
It happened to you, but you had it fixed.
Correct.
Okay, but if you don't have it fixed, you know how odd that looks. I put a little bit over here to make it look like it was a muscle.
Oh, wow.
Okay. I had a guy with a pec tear. I'm sure you've seen maybe a guy with a
Yes, sir.
pec looks like there's a hole in his chest.
Yes, sir.
I put filler there too to lift it up. You see? So a lot of neat things you could do with this. So does that answer your question about the filler?
Yes, sir.
Okay. All right. Did you have any other questions?
Right now, I do not.
You don't? Okay. All right. Your expectations. Let's talk about that because you have a certain size in mind, right? So each treatment usually will yield about 3/4 of an inch to 1 inch increase in girth,
Okay.
which is significant. Okay. However, I do recommend eventually doing a second treatment because I like to get 1.5 inch to 2 inch gain.
Okay.
Because that's when there's a substantial difference between what you started with and what you're ending up with. I usually recommend a girth size of 6.5 to 7.5, depending on who you married or no. No, married. Okay.
In between.
In between. Okay. All right. So whoever you're with, right? I know that after interviewing thousands of my patients, we have this girth size that I recommend 6.5 to 7.5. There's a reason for that. When they get into that range, it appears as though they get great reports back to me on how stimulated their partners are. Bottom line. All right, what we're going to do is this. If you don't have any other questions, we're going to first get you in one of the rooms.
Okay.
Just put numbing cream on for a while. Okay, the numbing cream actually does most of the work.
Okay.
All right. After about, let's say, half hour, 45 minutes, we'll give you a couple small shots of lidocaine, very simple and fast. Usually you don't feel much of that because the numbing cream is very powerful, okay? But we have to make sure you're numb, right? So we got to give you a couple of shots. And then after that, I'll come in and we'll get the filler going. Now you could watch us work, or you don't have to watch us, but we could chat. I could tell you what's going on. I could do a little area and show you, and periodically show you if you want. I allow my patients to do that because some of them have an interest in watching and so forth, and you're welcome to do that. After we finish with the filler, we're going to show you how to wrap, okay? Now, it's very important to learn to do that correctly, right? Because the filler is still liquidy, right? So if our wrap is all, let's say, tighter in the middle, it might push some of that filler out of place. So you want to put maybe a slight hourglass shape. We don't want that, okay? And I know you're going to do well. I'm not worried about it. It's just years ago when I had an older technique, when I used a cannula, we had less control of the filler. It used to float underneath the skin. Today we're going to put it in the skin. It's more stable there. But years ago we didn't have that luxury. So I had to rely on my patient's compliance to make sure it was right on the wrap. And sometimes it wasn't, okay? But now you really have to want to mess up to get the shape wrong, because it really is fairly stable. So you have to deliberately make it tight in an area, which you're not going to do. And we'll show you how to do it. It's not rocket science, okay? Then we'll show you how to wrap. After that, we'll go over your medications. This will be certain pills, certain topicals you put on, and then how we're going to communicate thereafter. It's very important for us to see what you see. For example, 3 days from now, you're going to change your wrap. You're going to change your wrap every 3 days approximately, twice a week. What's going to happen is, when you change your wrap, let's say, what's today, Thursday? Let's say Sunday, okay? This time you jump in the shower, get everything wet, take it off, the wrap. Soap up everything, rinse and dry. And then before you put your wrap on, since you're looking at skin, we want to see skin too. So you take a couple pictures. Then when you put your wrap on, take a couple pictures. After that, you send them to us, of course, through the Zingle HIPAA compliance system thing. Yep. And if it looks good, well, we'll say it looks good, continue protocol, okay? If you have questions, you type them in. You say, hey, what's this, what's that, how do you do this, whatever, and you will. You don't even know what to ask yet, okay? You're gonna find out today, and then tomorrow you're gonna have a question, and next week you're gonna have a question, and we're ready for it, okay? We know what you're gonna ask already, okay? All right, so after we go over your medications and so forth, then we'll kick you out, okay? You head back home. We'll talk about posture too, because posture, you know, when you're dealing with the penile area, let's say you squat down. What does the penis do? Tucks tails and run. It's going to tuck tail and run, right? It's going to head right in. But we don't want that, because we got all this filler here. Now, if the penis pulls in, it's going to do something. Put pressure on that filler. And we don't want to displace anything. So what do? If you're walking, you drop your keys. How are you going to pick them up? You drop on one knee. Okay. That's the key. When you're driving, tilt back a little bit. Take the pressure off, because 90 degrees is not our friend either. No. Okay? So tilt back. Now, let's say you're having dinner with your mom, your parents, your girlfriend, whatever. It doesn't matter. You can't really eat like this now. Okay, so you just drop your knee down a little bit. Okay. Spread your legs. And you'll see it takes the pressure off. Very simple, okay? But you got to get into the habit of that, and I'll tell you why. Of course, you want the results to be good. But the second treatment, the filler can move more. Okay. So you have to be super strict. So I want you to learn now what you need to do. Very important, okay? And when you get into the habit of it, eventually when you do your second one, we don't have to worry. Okay. Okay? Just so you know. Any final questions for me?
So I have had the temporary fillers in the past. That doesn't affect the filler that you provide, correct?
Whatever shape it's provided you, or whatever remains there, I just assume it's not there. Because when I put filler in, I'm thinking, hey, that filler, your temporary filler is going to dissolve. So I cannot base my placement on what's there, because it's going away. Give you an extreme example. Let's say all the temporary's bulged up somewhere. Well, I can't make every other area bigger just to balance that, because what's going to happen is if that temporary filler, when that temporary filler dissolves, you have a hole. So I'm just going to put it in as though it's not there. Okay? And then as it dissolves, if it's going to cause any minor imbalance, it'll go away over time. You'll see it getting more balanced. Okay? But that was a good question. I'm glad you told me that. Was that, if you didn't list it here, we're going to put it here. But that's okay. That's all right. We can do that. All right. Any other questions?
My only other one would be as far as exercise. When I do exercise, obviously I can't be, squatting, correct.
Okay. That you know. So the postural limitations you know. And I don't mind you working out. Here's the problem though. Sweating. More moisture in the genital area, more bacterial growth. Okay, so you can work out, but you have to be willing to change the wrap. Okay, so if you're an avid lifter and you're lifting, you're not lifting every day, are you?
Yeah. But I can change that though.
Maybe 4 to 5? Okay, I don't really mind you changing every day if you're okay with it. Okay, it's just that the sweating would bother me. Okay, changing the wrap is relatively easy when you get used to it. But what we have to do is, if you're gonna let's say lift at least 5 days a week, maybe if every day if you wanted to, we'll have to give you extra wrap material.
Okay.
Okay, just request that and tell them that, because I don't want to forget that.
All right.
Okay? Otherwise you'll be running CVS, you run out of stuff, you got to go over there, whatever. Okay, any other?
I do not believe. I think I'm good now.
Okay, all right, what we'll do is we're going to head to the back, get you started. Again, you're going to sit there for a bit. They're going to put a couple of videos on for you. Okay, it's unfortunately of me. Okay, so you're going to see me again going over some other details and so forth. And even after that video, when I come in, they're going to numb you afterwards too. But when I come in, if you have questions, we can go through that too.
Perfect.
You can kind of talk through the whole thing, honestly. Okay? All good to go?
Sounds good.
All right, my friend.
All right. Thank you very much.
You're very welcome. You're very welcome.